Assalamu alaikum, beta. In this video lecture, I will deliver the lecture on disc germinoma and onwards. I have started delivering the germ cell tumors in the part 1 video, and this is the part 2 video of the germ cell tumors. In the part 1 of the video, I delivered the teratomas, and now in this part, I will deliver the disc germinoma and the yolk sac tumor beta. Okay. Uh, as mentioned earlier in the part 1 video that the dysgerminoma they do arise from the undifferentiated cells. They arise from the undifferentiated cells beta. By the way, this dysgerminoma which arise from the undifferentiated cells in the ovary, the germ cells, this is the most common germ cell tumor of the ovary. This is most common, remember, number one common germ cell tumor of the ovary. Okay, and it is, by the way, the ovarian counterpart of the testicular seminoma. I hope you understand this term beta. The okay, जहाँ मेल के अंदर टेस्टिकल्स पे सेमाइनोमा होता है, वैसे ही फीमेल के अंदर ओवरी में डिसजर्माइनोमा होता है. सो एक्चुअली दिस डिसजर्माइनोमा इज द ओवेरियन काउंटर पार्ट ऑफ द testicular seminoma. Okay, and by the way, this dysgerminoma makes up only 2% of all the ovarian cancers and 50% of the malignant ovarian germ cell tumors. अगर सारे के सारे ovarian cancers में से देखें तो बेटा dysgerminoma is just 2%. But अगर हम germ cell tumors जितने भी हैं malignant, उनके अंदर dysgerminoma makes up 50%. Okay, and the incidence of dysgerminoma is high in childhood and can be seen up to 75% in the second and the third decades, okay, of the life. And you know beta, the incidence can also be high in females with the gonadal dysgenesis. The females which are suffering from gonadal dysgenesis, they can also develop this germ cell tumor dysgerminoma. What type of gonadal dysgenesis? That can be pseudohermaphroditism. I hope you know this term beta, pseudohermaphroditism. Pseudohermaphroditism is the female having actually having female gonads that are the ovaries, but the external genitals are not of female, they are more like male. This is the female pseudohermaphroditism, that the gonads are ovaries that are female gonads, but the genitals are not more like female, they are more like male. Okay, right. I hope you are clear so far beta. Right now beta, most of the dysgerminoma are non-functional, that they do not produce anything. But अगर dysgerminoma के अंदर कुछ syncytial trophoblastic cells मौजूद हों जो कि नॉर्मली प्लेसेंटा में मौजूद होते हैं, और वहाँ पे syncytial trophoblastic cell क्या करते हैं, बीटा HCG को सीक्रेट करते हैं. तो बेटा अगर dysgerminoma के अंदर syncytial trophoblastic cells मौजूद होंगे तो फिर ये dysgerminoma क्या करेगा, it will give you beta HCG. Okay, by the way, dysgerminoma are non-functional, but if the dysgerminoma contain syncytial trophoblastic cells, then this dysgerminoma will give you HCG and there will be elevated levels of HCG in your blood serum, and this finding correlates with the presence of the syncytial trophoblastic giant cells in the tumor. अगर ट्यूमर के अंदर syncytial trophoblastic cells मौजूद हैं तो उसी सूरत में डिसजर्माइनोमा HCG सीक्रेट करेगा, अदरवाइज नॉट. ओके, अदरवाइज इट विल बी नॉन फंक्शनल. राइट, लेट्स गो लिटिल अहेड बेटा. लाइक समाइनोमा इन द टेस्टिकल्स ऑफ द मेल, this germinoma in the female ovaries can express some markers that are very important to remember for your exam purpose. That can be OCT3, OCT4, that are the octreotide 3 and the octreotide 4, and NaNOG molecule. Okay, these are very important markers that are produced by dysgerminoma and can be used for the diagnosis of dysgerminoma. Okay, so what is the underlying pathology? What are the mutations that are responsible for this germline tumor dysgerminoma? About one third of the cases, they show some mutations which are gain of function mutation in the KIT gene. Gain of function mutation in the KIT gene. If this KIT gene shows gain of function mutation, then there will be increased expression of the receptor tyrosine kinases. If the expression of the receptor tyrosine kinases is increased, beta, what will happen with this? There will be increased uncontrolled cellular proliferation and you will develop condition called dysgerminoma. Okay, so now you know the underlying mutation beta. gain of function mutation in the KIT gene. Right. Now let's talk about the morphology of dysgerminoma beta. Morphology of dysgerminoma. Okay. Yeah. Up to 80 to 90% of the dysgerminoma are beta unilateral. That means they involve the single ovary, only one ovary. Okay. And the size of the dysgerminoma beta, it ranges from, it can be a barely visible nodule, a very small nodule, to a big mass. It can be a very small nodule or it can be a big mass. So size range. Okay. If you have a cut section of the tumor dysgerminoma, and then on the cut surface you will see there is solid yellow white to gray pink appearance of the tumor, and which is very much soft and fleshy. If this is a tumor and you produce a cut section and you see and you look into the tumor, there will be that will be very much solid yellow white to gray pink appearance and will be very soft and fleshy tumor. Like seminoma in the testicles of the male, it is composed of cells which are having some very much characteristic features. What are those characteristic features, beta? What are those characteristic features? That the cells, they are large and vesicular. Their cytoplasm is very much clear and prominent borders, well-defined boundaries of the cell. And their nuclei are very much centrally placed, and they are regular nuclei. The cells grow in nests or the cords, and the cells are separated by the scant fibrous stroma, which is infiltrated by some inflammatory cells like the mature lymphocytes and occasionally granulomas. What does this entire thing mean? Let me tell you, beta. Let me tell you that if, let's suppose, this is your dysgerminoma. This is your dysgerminoma, and it is actually composed of cells. Obviously, it is a tumor. It has to be lots. It has to have lots of cells. These are so many cells. These are so many cells of dysgerminoma. Okay. And can you see, beta, that the cells are growing in the nests or cords? कोड की फॉर्म में या नेस्ट की फॉर्म में सेल्स ग्रो कर रहे हैं, एंड द सेल्स आर एक्चुअली सेपरेटेड. The two cell nests are separated from each other. What is this space between the two cell cords? This is the stroma. This is the fibrous stroma present. So now you understand, beta, what I was trying to say. That this is the dysgerminoma, in which the cells are growing in the nest-like fashion, cord-like fashion, and the cells are separated by the fibrous stroma, and this fibrous stroma is actually infiltrated by there may be granulomas or some mature lymphocytes. Okay. And the cells of this tumor, if you take out a cell, then you will see the cell is very much large and vesicular. Its cytoplasm is clear and the boundaries are well defined, and the nuclei are centrally placed. Okay. Right. Now let me show you the histological image of whatever I just told you to have better understanding of morphology. This is the typical dysgerminoma, beta. Can you see these are the cells? These all are the cells. These all are the tumor cells. These all are the cells of dysgerminoma. And can you see these cells are actually separated by these septa, fibrous septa. Okay, you can see just a second like this. Okay. Can you see, beta, these all are tumor cells. Okay. And they are separated by these fibrous septa. So जाहिर सी बात है, इसके आगे भी दूसरे बेटा ट्यूमर सेल्स होंगे, तो बीच में तो ये आपका फाइब्रस सेप्टा आ गया ना, तो बीच में ये आपका फाइब्रस सेप्टा आ गया. एंड व्हाट डिड आई टोल्ड यू, व्हाट डिड आई से, that these fibrous septa are infiltrated by, you can see these mature lymphocytes. Okay. So these are the tumor cells of the dysgerminoma which are separated by these fibrous septa. तो फ़र्ज़ करें ये अगर ट्यूमर सेल्स हैं तो कुछ ट्यूमर सेल्स यहाँ पर भी होंगे. तो these tumor cells and these tumor cells are separated by this fibrous septa having lots of mature lymphocytes as well. And if you just zoom into one dysgerminoma tumor cell, so I can even show you that, yeah, the cells are very much, if you look at just a second, yeah, cells, beta, tumor cells are very much, okay, this is a large tumor cell with clear boundaries, prominent regular nucleoli, and it is a vesicular, okay, with clear cytoplasm. So far, what did you learn in the morphology? Beta? That this tumor These are the tumor cells which are separated by the fibrous stroma, which is infiltrated by the lymphocytes and the granuloma. And these are all the tumor cells, and each tumor cell is large, vesicular, having clear cytoplasm, well-defined boundaries, and centrally placed regular nuclei. Even I have a better picture to just zoom into this each cell of the tumor. Okay, if I go a little here, yeah, there we come up with this. Okay, okay, can you see this better? If I just zoom in further, this is the dysgerminoma. These are the cells of the dysgerminoma. These are the cells of the dysgerminoma, and you can see this cord or nest of dysgerminoma cell and this nest of dysgerminoma cell, they two are separated by this fibrous stroma, and you can see fibrous stroma is infiltrated by these lymphocytes. Okay, and if you look into this the cells of the dysgerminoma, you can see how clear is this cell. हाउ क्लियर इज दिस सेल, कितनी ज़बरदस्त प्रोनाउंस्ड बाउंड्री है इसकी, और सेंट्रली प्लेस्ड न्यूक्लियाई है, और ये सेल भी अच्छा खासा काफ़ी बड़ा है और क्लियर साइटोप्लाज्म है इसका बेटा. आई होप यू आर क्लियर नाउ. Okay, now let's go a little ahead. Then you have to note a point beta, that occasionally small nodules of dysgerminoma are encountered in the wall of the benign cystic teratoma. I delivered the lecture on teratoma in the part 1 of the video. That teratoma also develops in the ovary. That if let's suppose this is a teratoma, and occasionally what happens that some nodules of dysgerminoma may be present, may be encountered in the teratoma. So this is a teratoma, benign cystic teratoma in the ovary, and these are the nodules of the dysgerminoma. These are the nodules of the dysgerminoma that may be encountered in the teratoma. Or sometimes what happen, if this is a dysgerminoma, so it is possible that dysgerminoma tumor may contain small cystic teratoma, कि dysgerminoma tumor के अंदर कुछ small cystic teratoma मौजूद हों. So both possibilities are there, that if there is a tumor, this is the teratoma. So in teratoma there may be some nodules of dysgerminoma encountered, or it is also possible that there is a dysgerminoma inside which is present some cystic teratomas. Okay, I hope you are clear with this now beta. Don't forget, all the dysgerminoma are malignant. There is no story of benign or borderline dysgerminoma. Dysgerminoma are almost all always malignant, and don't worry, they are not all aggressive. They are malignant, but only 1/3 are aggressive. Okay. The possible treatment is salpingo-oophorectomy, that is the removal of beta ovary and the fallopian tube. This will give you the excellent prognosis, up to 96% cure rate. But make sure your tumor is unilateral, it is localized in the early stage without metastasis. Okay, लेकिन हाँ, अगर मेटास्टेसाइज कर चुका है तो उसके बाद साल्पिंगो-ओफरेक्टोमी आप करते हो तो उसके बाद भी बेटा प्रोग्नोसिस अच्छी नहीं होती. ठीक है, सो मेक श्योर इट इज़ यूनिलेटरल, it hasn't really gone for metastasis. So salpingo-oophorectomy is going to be a really good option. Okay, right, this is all about dysgerminoma beta. After this dysgerminoma, if I continue with this here, just a second. Yeah, okay, I have beta now yolk sac tumor to continue with. Yolk sac tumor, number 1 germ cell tumor which we did, that was teratoma. Number 2, which we just covered, it was dysgerminoma. And now at number 3 is yolk sac tumor. Yolk sac tumor arises from where? From germ cells that differentiate along the extra embryonic yolk sac. Okay, so from where do they arise? From the germ cells that differentiate along what beta? Extra embryonic yolk sac. And remember beta, this is the second most common germ cell tumor after dysgerminoma. I told you dysgerminoma is by the way, most common germ cell tumor, but yolk sac tumor is second most common germ cell tumor. Germ cell tumor, okay. Yolk sac tumor is also known as endodermal sinus tumor, And you know what, beta, yolk sac tumor expresses a very important marker, that is alpha fetoprotein, just like the normal yolk sac produces. Okay, so it is going to be a very important exam question, that what is the marker for the determination and the diagnosis of the yolk sac tumor especially. It is going to be alpha fetoprotein, beta. And a very important histologic feature of the yolk sac tumor that is very much characteristic, that is present in the yolk sac tumor. And if you find this feature in any tumor, if you find this feature, then it is for sure it is yolk sac tumor. Then what is this feature, beta? This feature is only present in the yolk sac tumor. Let me show you and let me explain you first what this feature is. There is actually the formation of the glomerulus like structure in the yolk sac tumor. Okay, there is formation of glomerulus like structure. How does glomerulus appear in the normal nephron of the kidney? There are actually the blood vessels and the cells surrounding it. So what happens in case of the yolk sac tumor? There are actually the central blood vessels which are enveloped by the tumor cells, and these tumor cells which are enveloping the blood vessels, these tumor cells are further enveloped, further lined by another layer of tumor cells. So this entire ring is called Schiller dual body. So Schiller dual body is the characteristic histologic feature. Schiller dual body is the characteristic histologic feature, and this is the glomerulus like structure which is present in yolk sac tumor. Okay, so this is very important diagnostic point, beta. So let me show you, beta, the Schiller dual body. This Schiller dual body is nothing but just glomerulus like structure. Yeah, let me show you, beta. There we go. I hope it is visible to you, beta. Okay. Yeah, there we go. In this, what do I have? Beta, this entire is the Schiller dual body. This entire is the Schiller dual body. Schiller dual body. What should be in the Schiller dual body? Number one, central blood vessels. Okay, there we go. These are the central blood vessels. Okay, these are the, just zoom it further. There we go. These are the central blood vessels. Okay, number one thing. Number two thing, these central blood vessels enveloped by tumor cells. Okay, these are the central blood vessels. These are enveloped by these are the tumor cells. Okay, we are clear so far. And then these tumor cells which are enveloping the blood vessels, these tumor cells which are enveloping the blood vessels, they are further enveloped by tumor cells. You can see there are further tumor cells which are enveloping the tumor cells which were enveloping the blood vessels. So these are the blood vessels in the center which are enveloped by the tumor cells, and these tumor cells are suspended in this cystic space, and then after the cystic space is this layer of tumor cells. Okay, so blood vessels enveloped by the tumor cells, and these tumor cells are further enveloped by another layer of tumor cells. Okay, this is what it was required. The central blood vessels enveloped by tumor cells, which are further enveloped by another layer of the tumor cells. Okay, this entire is called the Schiller dual body, beta. Okay, isn't it a glomerulus like structure, beta? It is somehow. Okay, and what did I say you, beta? It expresses the alpha fetoprotein, by the way. And alpha fetoprotein, there are, by the way, intracellular and extracellular hyaline droplets as well in the inside and outside of the tumor cells, and these droplets stand for alpha fetoprotein. I just mentioned that this tumor expresses the alpha fetoprotein. You can stand the alpha fetoprotein and you can say, okay, this tumor is producing alpha fetoprotein, so it may be yolk sac tumor. How do you stain alpha fetoprotein? By using what technique? Immunoperoxidase technique. Okay, immunoperoxidase technique. Right. The clinical picture of the yolk sac tumor, beta. How does yolk sac tumor present? In children and in young women, it present with obviously abdominal pain and the rapidly growing pelvic mass. Oh, okay. And the treatment is going to be the chemotherapy, and it is going to give you 80% survival. So that's it, beta. That's a yolk sac tumor. And there we come up with the choriocarcinoma. That is the last germ cell tumor I will discuss. Okay. So it is having, by the way, the placental origin. कोरियोकार्सिनोमा ओवरी में भी डेवलप होता है, ठीक है. कोरियोकार्सिनोमा प्लेसेंटा से भी ओरिजिनेट होता है, ठीक है. the one originating from the ovary is more common than the one originating from the placenta, don't forget. Okay, as I mentioned that the choriocarcinoma exists in combination with other germ cell tumors. For example, ovarian choriocarcinoma, coexisting with the placental choriocarcinoma. And don't forget, choriocarcinoma, whatever it is, it produces high levels of HCG, beta HCG, okay? And in contrast to choriocarcinoma that arise from the placenta, the choriocarcinoma which arise from the ovary are unresponsive to chemotherapy and are fatal. So the choriocarcinoma that arise from the ovary is not responsive to chemotherapy and it is very much fatal. Okay, but the choriocarcinoma that arise from the placenta is responsive to chemotherapy and it is not that fatal. Right, so that's all about beta, the germ cell tumors. I hope you got the concepts. If you did, you can appreciate me by liking to the video and subscribing to the channel. Thank you so much beta. Class dismissed.